Hello guys, my name is Vijay. Today, me and my friends from the White School International are going to talk about something that's really important. So, do you know this month is dedicated to breast cancer? Yes? No? Don't worry, we'll guide you through this. So, to start with, here is Anushri to talk about the statistics related to breast cancer.
Breast cancer is the most common cancer in women both in developed and less developed countries. It is the most frequently diagnosed cancer among 140 of 148 countries worldwide. In many countries with advanced medical care, the 5-year survival rate of early stage breast cancer is 80 to 90%, falling to 24% for breast cancers diagnosed at a more advanced stage. Breast cancer is on the rise both in rural and urban India. Cancer survival becomes more difficult in higher stages of its growth, and more than 50% of Indian women suffer from stage 3 and 4 of breast cancer.
Here is Swasti and Nagarjun to talk about self-examination related to breast cancer.
Breast self-exam or regularly examining your breasts can be an early detection for breast cancer. So the steps are as follows. Check both sides for lumps or thickenings. Show above or below your collarbone. Swelling or thickening of all part of the breast. Dimpling or irritation of breast skin. Localized or persistent breast pain. Redness, scaliness or thickening of the nipple or breast skin. Nipple discharge or any change in the size or shape of the breast.
Although the breast self-exam isn't the most reliable way to find out if you have cancer or not, most women report that they discover the first sign of cancer on their own. So after the self-exam, if you do find a lump, do not panic, as not all types of lumps can cause cancer. Secondly, do not hesitate to call your doctor and schedule a checkup with him. Make sure you get a proper explanation from your doctor about the formation of the lump. And if you feel like asking a second opinion, go for it. Your second opinion can even be at a government healthcare center.
Now Zain is going to give you a brief about risk factors related to breast cancer.
Most people believe genes and age are risk factors for cancer, but there are lesser unknown factors. 40% of diagnosed cancers is because of overweight and obesity. Alcohol consumption is another risk factor. Women who drink alcohol thrice in a week have a chance of breast cancer. Redness and rashes are sign of breast cancer. Breast cancer does not target only women. Every year, 3,000 men are diagnosed with breast cancer.
Nice. Now Shahana is here to explain about how to prevent breast cancer.
Preventive measures for breast cancer. There is no such way you can prevent breast cancer, but there are things that you can do to reduce the chances of the risk. This is certainly helpful for women who have strong family history and certain gene changes. Things that you can do are reduce alcohol consumption, don't smoke, control your weight, avoid exposure to radiation and environmental pollution, breastfeed. The more you breastfeed, the better, and reduce the doses of hormone therapy.
Great. Now Vishnu is here to talk about cancer treatments.
The different types of breast cancer treatments are lumpectomy and mastectomy. Lumpectomy is the removal of the tumor and the small cancer-free margin of the health tissue around it. And mastectomy is the removal of the entire breast. So to summarize, the available surgical treatment options are removal of cancer in the breast, which is lumpectomy or partial mastectomy, which is generally followed by radiation therapy.
Someone tells or thinks breast cancer only occurs in women. You are dead wrong. So here is Shadil to explain on that.
Though breast cancer is most commonly thought as a disease that affects women, breast cancer also does affect men. Both men and women are born with small amount of breast tissues, but their development may vary. The breast cancer in men is due to irregular growth in these tissues. The most common type of breast cancer in male is ductal carcinoma in situ. The breast cancer in male can be cured by detecting earlier with proper care and treatment. Thus, it is important to spread awareness and clear the misunderstanding that only women are at the risk of breast cancer.
Awesome. Now here is Afra to talk about taboos related to breast cancer.
It would be wise and the only remedy to bring down the number of cases and the subsequent complications is to go for regular checkup including mammography to ensure early detection and treatment with least possible expenses to save life. As we should always depend on latest technology and science rather than holding on to social stigmas and taboos. Brain is the most intricate organ in the human body. And the psychological effect of the brain is not yet explored completely, except for the fact that there might be a little psychological effect in resisting any kind of disease, particularly cancer, as it has a direct relation with stress and belief. Scientifically speaking, Mangal Sutra has or might have very little to save a person's life from breast cancer.
Alright, now Ibrahim is here to give a short brief on foundations and trust roles in breast cancer.
There are foundations like minor foundations, breast cancer research foundations, breast cancer prevention partners, etc. These foundations are non-profit organizations who are dedicated to provide funds for increasing breast cancer awareness. They also provide health education and gives better treatment to patients. They promote detection of cancer.
Now, Leah is here to give you a detail on breast cancer survivors.
There are people who successfully went through breast cancer, and I name a few of them. Robin Roberts. Robin Roberts was a co-host of an American news show, Good Morning America. She had a doubt, she self-examined and found out that she had breast cancer in the 2007. But she came through it, she fought through it, and now she even talks about it in a few of her shows. Amy Robach. Amy Robach is a co-worker who worked alongside with Robin Roberts. She found out that she had breast cancer in 2013. However, even though with a lot of hard work, she went through it, chemotherapies, she fought through it, and now she's living as a brave and a beautiful person. Wanda Skies. Wanda Skies is a famous US comedian who is a very positive, cheerful, and of course a humorous person. Unfortunately, she found out that she had DCIS, which is basically a stage 0 breast cancer, in 2011. However, with no worries, she fought through it and she even talks about it on one of her shows.
Now let's go to Safa, who's going to break all the myths related to breast cancer.
Myths of breast cancer. If you maintain a healthy weight, exercise regularly, eat healthy, and limit alcohol, you don't have to worry about breast cancer. The fact is, all of these behaviors can help to lower your breast cancer risk. They can't eliminate it. It's something we hear again and again from newly diagnosed women. I eat healthy, I'm at a healthy weight, I'm active, and I barely drink. So how do you end up with breast cancer? Yes, there are evidences that these behaviors can help to lower your risk. However, they can't guarantee you that you will never get the disease. There are so many examples of people who does everything right and still gets breast cancer. Consuming too much sugar causes breast cancer. But the fact is, there is no evidence that sugar in the diet can cause breast cancer. Breast cancer can always cause a lump that you can feel. The fact is, breast cancer might not cause a lump, especially when it first develops. Using unrummed antiperspirant can cause breast cancer, but the fact is, there is no evidence in connection of unrummed antiperspirant and breast cancer. Supporting the fighters, admiring the survivors, honoring the taken, never ever give up hope.
Last but not the least, here is Harun to conclude.
Angelina Jolie was an American actress, filmmaker, and a good humanitarian. Genetically, her family has a greater possibility to infect breast cancer. Even some of the people in her family also died because of this disease. Her doctor estimated that she had a greater 87% of possibility to infect breast cancer. By understanding the reality, she decided to survive. She decided to overcome. For that, she started a 3-month treatment including a severe surgery. After the severe surgery, her possibilities decreased into 2 to 5%. Cancer is a word coming to all human hearts with full of fear, and we all are discouraged. Now, Within a blood test, you can understand what is your situation. Then you can take action. Cancer is also a curable disease nowadays. We can overcome. You can survive.